Hi, I am Dr. Mishra. I am a MBBS and MD in dermatology. I have been practicing dermatology in Delhi for the past 20 years and I have been in the field of hair transplant for the past 10 years. At Medhair, we are using, most of the people, they call us to inquire about what are the major techniques which we are using in hair transplant. We are using both the advanced techniques FUE and DHI in our hair transplant surgeries, and I'll give you the reason also, because most of the young people in FUT, you have to take out a piece of skin, a strip of skin from the back of the head, and it leaves a permanent scar on the back of the head, and most of the young people, they don't like to have a permanent scar on the back of the head. Although in some cases a combination of FUT and FUE is required to give better results to the patients, but those are very rare patients. But we prefer to do FUE and DHI technologies of hair transplant. As I told you earlier, in FUE we take out single grafts from the back of the head, which does not lead to any scar on the back of the head, and the density of the hair on the back of the head, which is the donor area, back and side of the head, it remains absolutely same after the hair transplant surgery as it was before the transplant surgery. So single grafts in FUE technology are taken from the back of the heads and they are implanted on the bald area, which is generally on the top of the head and front of the head and the crown area. And in purely FUE technology, what we do is we take out the grafts, we store them in normal saline outside for 2 to 3 hours, and then we implant it onto the bald area. And what is the difference between FUE and DHI is, in DHI we do not store the grafts outside the body. We first make the spaces, we take out the grafts without storing them outside the body, we immediately implant the grafts onto the bald area. So DHI is considered direct hair implant. It is considered to be the most advanced technique of hair transplant, and this is the technique we are following right now in most of our patients. And since there is no loss of grafts, because the grafts are not stored outside the body, the results are very good, and almost all the grafts, we can't say almost 100% grafts are taken, but we say more than 95% of the grafts are utilized. So we are able to give optimal and very encouraging results to the patients, and the patient is always very satisfied with these results.